Everyone, just please make sure you're on mute. And it's 10:30 now. We'll just give it a few more minutes just to get people to join, and then we'll go ahead and get started. Hello to those that just joined. We'll wait a few more minutes and then we'll go ahead and get started, just so everyone gets a chance to join us. Oh, whoops. Hold on, let me check on something real quick. So, okay, we'll wait one more minute. Happy Tuesday, everyone. Can't even believe we're already in May. Okay, so it's 2 minutes after, so I'll go ahead and get started. Please, just everyone, please make sure you're on mute. We will be answering questions, and you can certainly ask questions in the chat. Cynthia Del Rosario will be managing the chat. And before I begin, I just want to say I'm really excited. Today we have 4 RASC representatives joining us today. They're the RASC insurance liaison. We have Nicole Zimmerman, she's the HealthNet and United Healthcare. And then we have Alicia Riviera, she handles the Medicare plans. Jamal Beatty, Anthem and Navitus, and Mila Asfaha. Sorry, Mila, if I'm saying your last name wrong. They will be joining us today as well, and they're also going to be presenting some very important, useful retirement information at the end of my presentation. So I strongly encourage you to please stay on. All right, so hello and welcome. My name is Janelle Mirzai. Some of you may already know me. In this presentation, I will be covering the transition to UC retiree health insurance. This webinar is geared towards UCSB faculty, staff, and academic employees who are in the process of retiring or considering retirement in the next 5 years. Here's a brief look at the chapters I will be covering over this webinar. This presentation is intended for communication purposes only. It is not a guarantee of benefits. Details about the policies and health plans are available on UCNet. Let's talk about the future of retiree health. The University of California is committed to ongoing health benefits for retirees. However, it's not a guaranteed benefits. That means plan designs can change and your share of the costs may increase year to year. Understanding where you need to go and what you need to do will help you feel better equipped through your retirement process. The Retirement Administration Service, known as RASC, is the administrator and system of record for UC retiree updates and changes. RASC will remain your primary point of contact during your transition to retirement and after you retire. The best way to research, update information, or contact RASC would be through your UC Raise account. If you have not set up your UC Raise account, we strongly encourage you to do so. UCNet will continue to house all UC plan related documents, including plan contacts, booklets, and summaries, and upcoming open enrollment changes. myucretirement.com. This is Fidelity's website. It hosts financial planning tips, tools, including everything you need to know about UC supplemental retirement benefits and tax plans. RASC offers retirement counseling and advisory services. It provides a dedicated team of accredited financial professionals and personalized retirement counseling. We strongly encourage you to make an appointment to explore your options and determine what works the best for you. Let's take a look at eligibility. Here are some of the basic eligibility requirements when you retire. In order to be eligible for UC retiree health insurance, you must be enrolled or eligible to be enrolled in the UC coverage at retirement. You must elect a monthly retirement income. You can 10 or more years of UCRP credit for medical and dental, elect to continue coverage or suspend at the time of retirement. And if you select a lump sum cash out, you forfeit eligibility for retiree health benefits. All questions regarding your UCRP service credit or eligibility status should be directed to RASC, or you can make an appointment with a retirement counselor. Graduated eligibility. So currently, UC shares the monthly cost of medical dental coverage with eligible retirees up to a maximum UC contribution that varies each year depending on the overall costs. Retirees may be eligible to receive from 5% to 100% of the UC maximum contribution to premiums. This is known as graduate eligibility. The amount UC will contribute depends on the date you become eligible for benefits or your rehire date if you incurred a break in service of more than 120 days. The amount of service credit you have earned and your age at retirement. Please check out the Retiree Health Plan Premium Estimator for 2025, and it is located on UCNet. And you can see the cost estimate for each health plan. For more information about graduate eligibility, please contact RASC, or you can make an appointment with a retirement counselor. Let's take a look at frequently asked questions. When does retiree health insurance start? So if you separate in June with the July 1 retirement date, UCSB coverage ends July 31st, and UC retiree health and Medicare starts August 1st. What happens to my family when I enroll in Medicare? Non-Medicare members, non-Medicare retiree or family, they will remain in their current medical plan. Medicare eligible retiree and family, you will all enroll into a Medicare plan. Your opportunity to make changes will be annually with open enrollment, which takes place typically in the fall or if you move outside of the service area. So just like an active employee, you will have an open enrollment after you retire at the same time, and you can select a new plan. If I suspend, when can I re-enroll? If you suspend retiree health insurance, if you have other coverage, or you may enroll during open enrollment, or if you have an involuntary loss of coverage. Do Delta and Vision continue? Delta Dental continues with UC contribution. If vision coverage is something you're interested in continuing, you must select it at the time of retirement and you pay your premiums directly to VSP. Okay, so for those who are over 65, what is a CMS L56 form? So for employees or for their spouses who are age 65 or older and retiring, you will be given a special enrollment period at the time of retirement to enroll in Medicare Part B with the Social Security Office without a penalty. To be eligible for the special enrollment period, you must demonstrate that you had group health plan coverage through your employer or your spouse's employer. The HR department or benefit office locations can assist with the completion of the Section B of the CMS L56 form. Myself or Cynthia at the front desk here in HR, we can help you fill out this form. As soon as you have the form, you and your family members over age 65 must individually complete a copy of the CMS L56 form and provide it to the Social Security Office in order to enroll in Medicare Part B. Okay, let's take a look at the non-Medicare plan options. So if you're not Medicare eligible, if you are not Medicare eligible when you retire, you will remain in your current plan. If you're a retiree and covered by a UC medical plan, UC will send you a Medicare information packet with enrollment instructions 3 months before your 65th birthday. Please check UCNet to view your retiree 2025 monthly costs. One of the most common questions received at retirement is, what are my medical plan options? Let's start with the non-Medicare retirees and their family members. If you reside in California or a California service area, you will remain enrolled in your current employee plan, which is UC Blue and Gold, Kaiser, UC Care, Core, or the Health Saving Plan. One thing to keep in mind is the health saving plan is not available for new enrollments in retirement. So you must continue this plan from employment to remain eligible. UC Care, PPO, Core, and the Health Saving Plan are plan options for non-Medicare retirees and their family members who move or plan to move outside of California but remain in the US. Whereas if you're planning to move overseas, then UC Care PPO and Core will be your plan options. For our Medicare plan options, here's a quick overview, which I will discuss in more detail later. All right, so Delta Dental PPO and Delta Care USA, your coverage will remain the same. Premium paid in full by UC or subject to graduated eligibility. Delta Dental PPO has worldwide coverage. Delta Care USA is California only. This VSP plan, so VSP for retirees, this plan is optional. You pay full premium to the VSP. As some of you may know, our Medicare plans do provide yearly optometry vision coverage, but not glasses or contacts. So if you need, glasses or contacts, I strongly encourage you to enroll in VSP. I also wanted to share that UCLA Health has 3 clinics opened in Santa Barbara. So if you're interested in seeking care at UCLA Health, these clinics are accepting new patients, and the accepted insurance is UC Medicare PPO, UC Medicare Choice, UC High Option, UC Care PPO, UC Health Savings Plan, and our Core Plan. Okay, so before I go into more detail about our Medicare plan options, I do want to take a quick pause here if anyone has any questions. If you do, You can raise your hand. Okay. All right, so I'm moving on. I'm going to go into more detail about the Medicare plan options. Each UC medical plan has a Medicare version. You can see on the left-hand side that non-Medicare plans, which are UC Blue and Gold, Kaiser, UC Care, Core, and Health Savings Plan. Each of these plans have a partner plan. When you retire and become Medicare eligible, you will transition into the UC Medicare plan. That means if you're currently in the UC Blue and Gold HMO plan, you will automatically transition into the UC Medicare Choice plan. With Kaiser HMO, you will automatically transition into the Kaiser Senior Advantage plan. And for the Anthem PPO plans, you will automatically transition into the UC Medicare PPO plan. When a family has both Medicare and non-Medicare members, then the non-Medicare eligible members will remain in their current Medicare plan, whereas the Medicare eligible family members will transition into the Medicare plan. So if you have some family members who are not yet age 65, they will therefore remain in the UC Blue and Gold plan, while your Medicare eligible family members will transition into a UC Medicare Choice plan. This is what we refer to as split families. As a side note, the UC Health Savings Plan is not available to split families. So if you're enrolled in a health savings plan and you have a family member who is becoming Medicare eligible, then you would need to transition into either UC Care or Core, and your family member or you would transition to a Medicare PPO plan. Are you moving or thinking about moving after you retire? For the UC Medicare Choice, Kaiser, and High Option plans, you must live in California or a California service area. If you move outside of California but remain in the US, then UC Care Core would be your options. The Health Savings Plan will also be available for retirees who are enrolled in this plan prior to retirement and are not yet Medicare eligible. And the UC Medicare PPO plan is only available for split families. This means when some of your family members are eligible for Medicare and some aren't. However, if all of your family members are eligible for Medicare and you live outside of California, then you and your family would elect a plan through the UC Medicare Coordinator Program, which is administered through VIA Benefits. And we will take a closer look at this in the next slide. As mentioned in the previous slide, if you're living outside of California, but in the US and all your family members are eligible for Medicare, then you and your family will be moved to the UC Medicare Coordinator Program, which will be administered by VIA Benefits. For retirees eligible for the maximum UC contribution toward retiree health insurance, you will receive a $3,000 contribution toward a health reimbursement account for each member. This contribution is subject to graduate eligibility. This means if you're not eligible for the maximum contribution, you will receive a percentage of the $3,000 contribution. You can use these funds to purchase an individual Medicare health plan and a Part D through VIA Benefits. Any unused HRA funds will roll over to the next year. What if I'm thinking about moving outside of the US? What is available to me if I move, outside of the US? As many of you know, Medicare is a federal program. Therefore, you do not have international coverage through Medicare. If you plan on moving outside of the US, your plan options at retirement would be UC Care or Core plans. Both of these plans offer international coverage. Oh, skipped a slide. Now let's take a look at UC retiree health insurance premiums and how they are calculated. Each year, UC determines the maximum contribution paid towards retiree medical and dental premiums. Maximum contribution does not mean that UC pays retiree health insurance in full, but the retirees are eligible for the maximum amount UC pays towards retiree health insurance. That said, some retirees are eligible for the maximum UC contribution, and others may have graduated eligibility, which means they receive a percentage of the UC contribution amount. If you're eligible for the maximum UC contribution, you can find these rates on UCNet under the Retiree Medical Plan Cost 2025. The maximum contribution rate is listed under UCNet and is broken down into 4 categories. You'll want to research the category that you and your family belong to determine your UC premium. For folks with graduate eligibility, RAS will calculate your premium based on your age and years of service credit. You can find additional information about this in the Retirement Handbook on UCNet, your UC Raise account, or by checking the Retiree Premium Estimator, which is located on UCNet. Next, we'll take a look at Medicare and how Medicare and UC Medicare plans work together. Medicare is a federal program that provides medical insurance for people 65 or older, people with disabilities or specific medical conditions. Medicare covers most medical services but does not pay total cost of care, and it serves as the foundation for all UC Medicare plans. University of California requires all retirees and family members to enroll in Medicare if eligible. Coordinating your UC medical plan with Medicare helps sustain the retiree health program. And the exception is if you live outside of the US, you are not required to enroll in Medicare. Who is eligible for Medicare? I always encourage folks to contact the Social Security office if you have any questions about eligibility or to enroll. But the eligibility is based on your work history or the work history of your spouse. And typically, when does Medicare start? First day of the month in which you turn 65 for most. If your birthday lands on the first of the month, then Medicare starts the first of the prior month. Applying for Medicare is easy. You apply for Part A and B, or Part B if you're already enrolled in Part A. You complete the appropriate UBIN enrollment form to transition you into a non-Medicare to a UC Medicare plan. You inform and give your doctor your Medicare card and your UC Medicare card at your next visit. Okay, so let's take a look at different parts of Medicare. So Part A, it provides partial coverage for hospital stays, skilled nursing, and hospice services. Part B provides partial coverage for office visits, labs, and medical equipment. And then Part D covers prescription drugs. Now, I'm sure you noticed I skipped Part C. Part C is the name used for Medicare Advantage plans. Under the Medicare Advantage plan, you assign your Medicare over to the private insurance provider, and they manage your healthcare needs on behalf of Medicare. For Part C Medicare Advantage plans, they generally combine coverage for Part A, Part B, and Part D. And then, the 2 plans that we have that are, Part C plans is UC Medicare Choice and our Kaiser Senior Advantage plans. So 2025 Medicare costs. Medicare reviews your modified adjusted gross income reported on your IRS tax return from 2 years prior to determine your Medicare premium. So this year, Medicare will be reviewing your 2023 tax return to determine your 2025 Medicare premium. There's no monthly premium for Part A for most. As mentioned, it's based on your previous taxes and work history, so please confirm with the Social Security office. However, for most people, Part A is premium free. Part B premium for 2025 for most is $185. If you made more than $106,000 as a single person or $212,000 jointly, you'll pay the standard premium amount and then an income-related monthly adjustment, IRMA, which is an extra charge added to your Part D and Part D premium. And all this information is also listed on the Social Security website as well. Okay, so I know this part is a little bit, confusing. This is a question that I get a lot, but yes, you have a separate Medicare and UC premium. So your Medicare Part B, if you have a higher income, Part D premiums, it will be deducted directly from your Social Security check. If you're not yet receiving Social Security benefit, then Medicare premiums will be billed to you directly in 3-month increments. Whereas your UC medical and dental premiums will be deducted from your monthly pension check. Since vision is optional, you will pay your premiums directly to VSP. Now let's explore the cost of medical care. Medicare and your UC plan pay most of your medical expenses. They work together. Each of the plans have different benefits, cost, medical providers, service area, behavioral health providers, and de-enrollment processes. Please take the time to review your plan carefully. UC offers 2 Medicare Advantage plans. The first is UC Medicare Choice, which is a PPO Advantage plan. You assign your Medicare to the insurance plan. The provider bills insurance directly, and referrals are not required. For the Senior Kaiser Advantage HMO plan, you assign your Medicare to the insurance plan. Providers bills insurance directly, and you cannot use Medicare outside of this plan, and PCP referrals are required. So UC Medicare Choice is a PPO Advantage plan, and it's administered by United Healthcare. You don't need to assign your PCP, and you don't need referrals for specialists. You may use UHC doctors or Medicare doctors who accept Medicare assignment and are willing to bill United Healthcare. So this means if you have United Healthcare, when you go to the doctor's office, you provide your doctor's office with your United Healthcare card, because that will be your primary and Medicare will be your secondary. And when you're also searching for providers, you can go on the United Healthcare website and look for providers that accept United Healthcare. Under the Kaiser Senior Advantage Plan, you must select a primary care physician. PCP coordinates your care, PCP refers to specialist, and specialist is limited to medical groups. So this is typical with an HMO plan, the process. Under the UC Medicare Choice and Kaiser Advantage plans, you pay copays for care and you do not have a deductible. That way you know exactly what you're going to pay for each service, and then there's no surprises. Okay, so next is UC Supplement to Medicare plans. In addition to the UC Medicare Choice and Kaiser Senior Advantage Plan, UC offers 3 supplement to Medicare plans. UC Medicare PPO and UC Medicare PPO without pharmacy, and UC high option. Now, the UC Medicare PPO without RX is the exact same plan and design as UC Medicare PPO plan. The only exception that it does not include pharmacy. So if you select this plan, you would need to purchase a Part D plan outside of UC and provide that to RASC. Since these plans are supplements to Medicare, Medicare is the primary insurance and the UC Medicare PPO or high option plans will be the secondary. Under these plans, you have an annual deductible and you will pay a co-insurance after Medicare. Again, under the Medicare supplemental plans, Medicare is the primary and Anthem is the secondary. Therefore, when you need to see a doctor, you will visit the Medicare website.gov and search for providers in your area. And when you go to the doctor's office, you let them know, Medicare is my primary, and you provide them your Medicare ID card. In this hospital example, the Medicare Part A deductible is $1,676, and then pays the full Part A deductible for both the Medicare PPO and high option plans. Next example is for skilled nursing. In this example, for the first 20 days of skilled nursing are paid in full by Medicare. Then from the 21st to the 100th day, the rate is $209.50. For days 21 through 100, Anthem will pay 80% under the UC Medicare PPO plan and 100% under the high option plan. Okay, when traveling outside of the US, which I'm sure a lot of you will be doing after retirement, if you are traveling outside of the US, there are some things to keep in mind depending on which plan you're enrolled in. If you're enrolled in the Kaiser Senior Advantage Plan, emergency and urgent care services is only covered and you will have a copay. For UC Medicare Choice, emergency care, urgent care, and then some routine care is covered. You will have a copay. For UC Medicare PPO, there is a $100 annual deductible, and you will be billed 20% of the billed amount. And then for the UC high option, it's a $50 annual deductible, and you will be billed 20% of the billed amount. Okay. Behavioral health. Each of the UC retiree health insurance plans offer mental health care and substance abuse treatment. Coverage and provider networks do differ. Behavioral health coverage and providers for the non-Medicare plans are the same as the UC employee plans, whereas the behavioral health providers change once you transition into a Medicare plan. So for UC Medicare Choice, you can either select a Medicare or a UC Medicare Choice provider. With Kaiser, you can only see Kaiser providers. UC Medicare PPO, you can see a Medicare Anthem or a non-Medicare provider. And for the high option, it's the same, a Medicare provider or non-Medicare provider. Now let's take a look at the prescription drug coverage under the UC plans. Okay, so for Medicare Part D, you pay copays for prescriptions and some formulary lists depending on what plan you're in. Some formulary drugs do differ, but depending on what plan that you're in. And for your ID cards, UC Medicare Choice and Kaiser members, you will have one ID card and you will use that for both your medical and pharmacy. And for the Anthem PPO members, you will have two cards, one for medical and one from Navitus, which will be administered, yes, by Navitus for pharmacy benefits. All of the UC Medicare prescription drug plans have drug maximums. So each of the plans have a bundled prescription drug plan with the exception of the UC Medicare PPO without RX. Each of these plans have a prescription maximum. That means once you hit the maximum in the plan here, the plan will pay 100% of the cost for the rest of the year. If you are interested in the UC Medicare PPO plan without prescription drugs, this plan might be a good fit for retirees and graduate eligibility who may want to consider this plan to help reduce the out-of-pocket costs. If you have less than a number of years of UCRP service credit, please keep in mind Medicare allows only one Part D drug plan. You can enroll in the UC Medicare PPO without RX, but must enroll in the non-UC Part D drugs plan. You will need to provide proof of this coverage to UC in order to avoid penalties. And also, from what I've seen the past few years, a lot of people do select this plan if they don't utilize the pharmacy a lot, they don't have a lot of prescription drugs, then I see a lot of people do select this plan option. When you enroll in Medicare, it will depend on whether you are still an active working employee, retiring and turning 65, or retired and turning 65. Current employees, you must enroll in Part A when first eligible at 65. Oh, you not must. You may enroll in Part A when first eligible at 65, but it's not required. So if you're still working, you're not required to enroll in Part A, but most people do because it's free. If you enroll in Part A, do not enroll in Part B or D. Spouse enrolled in your UC employee plan, they're not required to enroll as well. And you will have a special enrollment period at retirement. Here are some special considerations. For the health savings plan, delay enrollment in Medicare Part A, B, and D until retirement. Please note, if you are drawing on a Social Security pension, you automatically will be enrolled in Part A at age 65. You cannot contribute to HSA. For domestic partners, at age 65, please consult with the Social Security office about when to apply for Medicare. And you may or may not have a special enrollment period while enrolled into an employee plan. You're eligible for Medicare when you retire. So please apply for Medicare Part A and B 2 months before you retire. Enroll online or call the Social Security office 2 months before UC employee retires. RASC will send the UBIN Medicare enrollment form. The RASC and the Social Security office will advise you on the CMS L56 form if you're age over 65 when you retire. If you become eligible for Medicare after retirement, then you will want to apply for Medicare Part A and Part B about 3 months before your 65th birthday. You can apply for Part A and Part B online on the Social Security website, or you can go to your local Social Security office and apply. These are some of the names of the forms you need to transition from a non-Medicare plan to a Medicare plan. For example, if you turn 65 and you are in the UC Blue and Gold plan, you will transition into the UC Medicare Choice plan. You will complete and submit the UBIN 121 form to RASC. For the UC Care, Health Savings Plan, and Core, you will fill out the UBIN 123 to transition to the UC Medicare PPO plan. And for the Kaiser HMO, you will submit the UBIN 127 to transition into the Kaiser Senior Advantage Plan. Once you complete your forms, you will need to submit them through either your UC Raise account by fax or mail. Please do not submit your forms online and by fax or mail. It will cause a delay and additional work for RASC. Please only choose one option for form submission. If you have any questions, you can certainly reach out to me. I'm happy to help, or you can reach out to RASC. Okay, let's review the timeline of events that occur for those individuals transitioning to Medicare during or after retirement. So you apply for Medicare A and B with the Social Security office. Social Security office confirms your enrollment. You send UC form to RASC. RASC and insurance update your plan. Insurance enrolls you into Part D. Insurance sends you new ID cards, and you inform providers of your new plan. If you aren't interested in coming back to work, but are interested in staying connected to the campus, I strongly encourage you to visit the Emeritire and Retiree Associations. Ellen Pasternak is our Emeritire Retiree Coordinator, and she sends out monthly newsletters and details of any upcoming local events. If you're interested in becoming a member or you would like to be added to her email list, please contact Ellen directly, and her contact information is listed there. Okay, so if you have any questions, you can, you can open a ServiceNow ticket. You can reach out to RASC, or you can reach out to me directly. I have my phone number listed and my email. So I will be your contact after retirement as well if you have, any questions regarding your retiree health insurance. Okay, well, that concludes my part of the presentation. Now I'm going to pass it on to RASC. They will go over some useful, important retiree information. So I believe it's Mila.
Yes.
Okay.
Thank you, Janelle. Um, okay, so if you have never heard of RASC before today, you're not alone. As a reminder, RASC stands for the UC Retirement Administration Service Center. We are the main office that manages your retirement benefits, things like pension payments, retiree health insurance, and UCRP disability benefits. We serve over 70,000 people across UC, including retirees and their families. So you just heard from Janelle, your campus healthcare facilitator, who went over important retirement health benefits information. RASC picks up from there. We handle the processing of your retirement, elections, and work with your insurance carriers to make sure your benefits are properly set up and maintained. We also provide personalized counseling to help you understand your options and feel confident as you plan your transition into retirement. Our goal is to work closely with your campus benefits team to ensure everything is seamless for you. You can move on to the next slide, Janelle. Thank you. Our retirement counselors are here to support you every step of the way as you plan, prepare, and transition into retirement. During your appointment, a counselor will walk you through your UC retirement plan benefits in detail and make sure you fully understand your options. The goal is to help you make informed decisions that align not just with your retirement needs, but also with your long term financial goals and legacy. Well, financial and legacy goals. Um, this is a great opportunity to get personalized advice that's tailored to your unique situation. To schedule a one on one appointment, you can just use the RAS portal. Next slide, please. Our insurance liaison team works behind the scene to ensure your retiree health benefits are processed smoothly and accurately. We collaborate with UC Path, campus partners, and vendors like Kaiser and United Healthcare and Anthem to resolve issues and assist with escalations and complex cases. In addition to behind the scenes support, we also provide direct member education. We offer Medicare webinars and office hours to help retirees stay informed, and we host open enrollment events designed for prospective retirees, current retirees, and their families to guide them through their benefit choices. While your healthcare facilitator is the main contact for health insurance questions, we are proud to complement that work with additional education and support. Next slide, please. So here are some of the most common questions we receive from new retirees. Um, like questions like Janelle already explained a little bit. When coverage end, when does coverage end? When or employee coverage ends? When retiree coverage starts, and what to expect when you become Medicare eligible. I'll walk you through each of these in detail in the next few slides. Next slide, please. So your employee insurance typically ends on the last day of the month following your separation date, which provides you with an extra month of coverage. However, if your retirement is after the first of of the month, your active employee coverage usually extends through the end of the second month after separation. This is the common source of confusion. So the example on the slide helps clarify how the dates work in both situations. In most cases, your health coverage will remain the same as it was when you were an active employee, unless one of the following applies. You are eligible for Medicare Part A and B and are enrolling in UC sponsored Medicare plans. Janelle already covered the UC sponsored plans, but I will revisit the topic in later slides as well. You are moving or you're moving to an area where your current plan, such as HealthNet or Kaiser, is not available. Next slide, please. After your forms are reviewed and processed, usually within 10 to 15 days, we work with your insurance carrier to finalize your enrollment. You'll know your retiree coverage is active when your insurance carrier sends you a welcome letter and a new health card. This is a good confirmation that everything has been completed. Next slide, please. Janelle also already gave you a great overview of the UC's Medicare plan options, but I want to take a moment to explain how you actually make the transition. So once you're Medicare eligible, you might wonder which UC plan is the best fit. If you're currently in one of the UC commercial Anthem plans, like UC Care or Core, those are for non-Medicare retirees. When you become Medicare eligible, you'll have the option to move into the UC Medicare PPO plan. To do that, you'll need to submit the UBIN 123 form. One thing that we always try to stress is to only download forms from UCNet directly or the ones mailed to you when you're ready to submit the form. We often see retirees prepare paperwork months in advance, but forms do get updated, and using an old version can cause delays in the processing. So be sure to grab the latest version when it's time to enroll. Nicole will talk about how to enroll into a UC Medicare plan via UC Race. Take it
Hi,
away, Nicole.
thank you, Mila. Hi, good
Mhm.
morning, everyone. My name is Nicole. Janelle, if you could go ahead and hit the next slide. So it was already spoke about how to enroll into a UC Medicare plan, but I really want to highlight about how to enroll via UC Raise. So this option will be available to you around the age of 65. So what you'll do is you'll go into UC Raise and then select retiree insurance, life event changes, and then the following steps are also included on this slide. But one thing I do want to call out is UC Raise is not going to be accessible if you're a new retiree. So if you're a new retiree at age 65 and are Medicare eligible, then you'll submit the UBIN forms directly to RASC. And then also open enrollment, life event is shut down 2 weeks before open enrollment and continues through the end of the year. And it will reopen around January 3rd. Can you hit the next slide, please? Here are some best practices for Medicare enrollment. One, please use a wet signature. We don't accept computer-generated signatures. If you do not qualify for Medicare, please submit your proof of ineligibility as it's required for proof. Pay all Medicare dues, or you can lose your UC Medicare coverage. Medicare plans go off of what Medicare system shows. Medicare requires physical addresses, so you cannot use a PO box. It has to be like a home address. So any address needs to go through. So if you have an address change, it will need to go through Social Security, and then you would need to inform RASC of your address change. Uh, please don't send any forms in that are signed 90 days prior to your start date or 90 days after. You can also track your form via UC Raise, or if you're not able to get into UC Raise yet, you may contact RAS directly and we can inform you of your status. Any changes to your date of birth or name must be updated with Social Security. Our vendors, such as United Healthcare, will not accept changes sent by UC alone. They require the Social Security and Medicare have the updated information before they will process any correction. Next slide, please. The Medicare offset is a monthly premium UC charges retirees who do not meet Medicare enrollment requirements. It ensures UC's retiree health plans stay compliant with federal and UC regulations. The offset premium is currently $419.60 a month, which is reviewed annually and typically increases if Part B premiums rise. UC requires retirees to enroll in Parts A if premium free and B if you don't, Social Security may also charge you a late enrollment penalty, and then UC will apply the offset premium under group insurance regulations. So key deadlines is turning 65, enroll in a UC Medicare plan by the end of your initial enrollment period to avoid charges. When you're retiring, you do have 5 months after your employee health coverage ends to enroll. The charges for the Medicare offset will start at month 6. If you're losing UC Medicare coverage, the offset applies until you re-enroll. If you're still out of compliance by April 1st after Medicare's general enrollment period, you risk losing coverage until you meet requirements. Medicare plays a critical role in supporting UC's retiree health program. Next slide, please. While individual Medicare plans are widely marketed and may seem like good options, they are not a part of UC's group coverage. Enrolling in one will disenroll you from your UC Medicare plan automatically and place you in a commercial plan, which is more expensive and can lead to penalties or even termination of your retiree coverage. Please always check with your healthcare facilitator, Janelle, or RAS before making any changes. UC Medicare plans are group health plans and are only available to benefit eligible employees. So here we do have a table of the comparison between an individual plan or a UC sponsored plan. With a UC sponsored plan, you get access to plans created just for UC. Some of the plans do still offer a Part B reimbursement, where individual plans may not. UC RAS can assist with escalated insurance issues. Like Mila and myself, we are insurance liaisons that would work with you during these escalated insurance issues. Enrollment is also more flexible as you can change during UC's open enrollment, that is in October. This is different than the annual election period. Next slide, please. This slide explains UC's updated policy for retirees who return to work. If you come back to UC in a position that is more than 43.75% of time, or if you're returning within 6 months of retiring, you will now be moved to what's called a mid-level faculty staff benefits. This change ensures that retirees returning are treated like active employees for health benefit purposes. Once you're eligible for those faculty staff benefits, your retiree health plan will be suspended. That means your medical coverage will shift from the retiree plan to an active employee plan. Under retiree benefits, there's no changes there, and your vision coverage stays managed directly through VSP. And I'm having a little bit of VPN connection issues. Can everyone hear me okay?
Yes, you were just breaking up a little bit.
Okay, thank you. Legal coverage is different. You can only pick either the employee plan or the retiree plan for legal services, but not both at the same time. If you are not yet enrolled in Medicare Part B and you expect to work more than 43.75% of the time, you may defer your Medicare enrollment while you're working. On the other hand, if you are already enrolled, reemployed. So we always encourage retirees to contact RAS before returning to work to fully understand how your benefits will be affected and what steps you need to take. Next slide, please. So if you are a rehired retiree returning to retiree medical insurance, if you lose UC employee medical coverage, for example, after ending employment, you can return to your retiree medical benefits. First, if your Medicare Part B was terminated or you're newly eligible, contact your healthcare facilitator to complete the CMS L564 form. Then submit the CMS 40B to Social Security by phone, person, or by mail. Once Medicare B is active, complete the UC retiree Medicare enrollment by submitting the UBEN 100 form. You can also send it by fax, secure message, or mail. Make sure to complete both steps to restore your retiree health coverage. And next slide, please. And here are some key RAS contacts and resources. Both the RAS call center and the UC Raise online portal provide services in Spanish to support Spanish-speaking retirees. Also, please remember to keep your contact information such as phone number, email, or mailing address up to date directly with RAS whenever there are any changes. Next slide, please. Right, and this slide has some additional retiree insurance resources that are provided by RASC. So the insurance liaisons do offer a monthly Medicare webinar, which is every fourth Thursday of the month from 10 to 11:30. And then we offer a little bit more intimately where it's a weekly Medicare Q&A. So if you're just kind of going through the process of Medicare or just have any questions, please feel free to join. And that's every Tuesday from 12 to 1. And we also offer a rehired retiree one-on-one. You can schedule an appointment with any one of us, any one of the insurance liaisons to kind of talk about that rehired retiree policy and to see how it may affect you. And that is all that I had. Thank you, Janelle.
All right, thank you so much. We're so happy that you were able to join us today, and now we can open it to questions. I see that there was a lot of questions in the chat, but if you can take yourself off mute if you have a question for us. What? No questions?
Hey, Janelle.
Oh,
I'll ask the question I just put in the chat. This is
okay.
John Gilbert. I'm cheating here because I'm already retired, but I wanted to watch.
Okay.
Uh, the 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 rules for Medicare coverage for during a return to active duty within 6 months of retiring, as I understand them, which is basically not at all, are really, really complicated.
Yes.
And it was really great. Was it Nicole? That it was great to have a little summary of that. But what's a reference to find out all the details? Where would you go? Is there a document online or another webinar or
Yes, great question. I know the rehire retire policy is confusing. It's, they're changing the rules and we're learning as we go as well. We do have a ton of resources online, which we can find. Hopefully, Cynthia, you can find it in the chat, or if anyone has it on hand, Rask, if you have it on hand. So just put the link in the chat. And then also, as Nicole indicated, she can do, or the insurance liaison can have a one-on-one with you just to go over your work history, just to see if, you will fall in that new policy, if you will have to disenroll from Medicare and enroll into mid-level benefits. Um, is there anything else you want to add, Nicole, to that?
Janelle, I can add.
Okay.
So our health and welfare department, they offer a webinar that's held every second Friday of the month. So there is actually a webinar that is going to be hosted this Friday, May 9th, coming up. So if you are available to attend that webinar to get more information, they will hold a Q&A session as well. So if you do have any questions, our health and welfare department would be able to answer those questions. And if you do need the link for the webinar, it is available on UCNet. If you type in the search field rehired retiree, it will take you to a link where you just click on going to work after retirement. And it has a whole bunch of information regarding the new policy. There is a recorded webinar that's included in there. So if you can't join on the 9th, you can watch the webinar beforehand. And if you do have any questions, then go ahead and attend the webinar on Friday.
Just to add, I put the link in the chat for those rehired retiree webinars.
Thank you.
Mhm.
Yeah, I see that. The link from UCNet, thank you, Cynthia, for posting that. And then thank you for Mila and Sheila posting the link for the webinar. Does that answer your question, John?
Yes, thanks. That's a big help. I appreciate it.
Okay, you're welcome. And then also, we're having two RASC representatives come. I'm sure a lot of you saw the communication. They're going to be here on campus on Thursday. And if you want to talk about the rehired retiree policy, you can schedule an appointment. Just call my office or the HR front desk and we can schedule an appointment with you.
I have a question.
Yes, Heidi.
Yeah, I have a retirement plan from another university. It's a TIA-CREF account, and I just wonder if I can get assistance in terms of figuring out how these two retirement packages would come together and inform any kind of Medicare costs and things like that. Can a retirement counselor at UCSB help me with both of those things?
Yes, a retirement counselor could assist you with those questions. We're going to have a retirement counselor be here on Thursday, or you can make a Zoom appointment with a retirement counselor online.
That's awesome. Thank you. Thanks.
You're welcome. So yes, if you want to make an appointment for in person on Thursday, go ahead and reach out to me. Okay, is there any more questions?
Janelle,
Yes.
John Gilbert did have a question about whether your slides will be available. I didn't know.
Yes,
Okay.
thank you, John. Good question. Yes, so the slides will be available on the healthcare facilitator website, on HR website.
Great. Thanks, Janelle.
You're welcome. Is there any more questions? We still have time. I'll stop the share. Okay. Yeah, so I'm gonna, as mentioned, I'm gonna post the slides on the HR website under healthcare facilitator, and I'll have all that information for you posted there if you want to come, always review again. Okay, if that's it, I will give you back your time. I just want to say how thank you so much for Ross for joining us on today's call. It's incredibly helpful and useful, and we hope to collaborate more with you in the future. Thank
Thank
you.
you,
Once again.
Janelle.
Thank you
Bye,
for having us.
everybody.
Bye.
Bye.